Role of platelet-rich plasma in erectile dysfunction. I invite Dr. Vijay Dahiphale sir. Sir, dice is yours. Thank you, sir.
On stage. He is MS, MCA, PM and MS. He is a general neurologist, andrologist, sexologist, and stem cell therapist. Practicing as a consultant neurologist, andrologist, sexologist, stem therapist at Nara Hospital, Mumbai. Prostate, stone and female urology, pediatric and transplant. Endoscopic surgeries, microscopic surgeries, treatment of sexual dysfunction and the infertility is his area of interest. He is the president of Dr. Dahiphale Medical Foundation Trust and Hospital by Dahiphale Multi-Super Specialty Hospital at Aurangabad. He is having centers at Pune, Mumbai, Andheri, Dadar, Kalyan, Nasik and Dubai. He do regular motivational speeches. Sukhi Jeevan on Sam TV every Friday, 11 p.m. And he has got many awards for his career. I welcome our well-known speaker, Dr. Vijay Dahiphale.
Thank you very much, madam. Good morning to all of you. All organizing committee, Dr. Satish sir, Venkatraman sir, Amit Mutha, and every member who is present or attending the conference, and every person in the organizing committee, our chairpersons, respected madam and respected sir. Today we are going to discuss on, we can say, a very important topic. Many times in beginning of my practice, I was also surprised how it will work. It was a big question with me, is how the cell we are putting in a corpora and useful for sexual dysfunction. So, how to explain, see, we have to reach to beneficiary. For that purpose, I am having these motivational talks on Sam TV in Marathi, Hindi and English. There are YouTube channels also. Why this is required especially in our this sexology faculty? Because Vijay sir, I know if you keep a speech, we are giving talk on sexual dysfunction community, all horribly rude. Everyone want to listen about the dysfunction, but nobody want to talk about the dysfunction and nobody want to accept the dysfunction. This is the problem. So everyone wants to just see in a Facebook, in a corner, in a room, or in an isolated area, even in family also. They always tell me, we have not seen your show because my mom, dad, my brother, sister are here. This is made for the motivation of every person at any age. It is basic sex education, and that motto we have presented to these talks. Then again, second question of privacy. Then we want some literature. We will read in alone. So for that purpose, we have started with this Marathi, Hindi, and English talks. And definitely, friends, for your information, I'll tell you, these types of talks are very much important in practice, like sexology, andrology, and maybe useful in so many faculties. So these are different centers all over Maharashtra we are practicing. We have a nodal centers with our. The reason is that catalyst for inquiry, every person don't want to travel for a long time unless and until you have a visit with that person, because they understand who you are. They will get a confidence. Unless and until that beneficiary patient don't get a confidence on you, he will not come for the treatment. That's the most important thing. Now, PRP. Now this pathological part, this microbiological part, that part is different. I describe, and then I come to exact procedure at the end. Most important part, how it works. Healing of musculoskeletal diseases, repair of nerve damage injuries, repair of muscle damage injuries, bone repair, plastic cosmetic surgery. Even last week also, there was a big conference in which all reconstructive tissue, in reconstruction, in repair, in healing, how it works. Oral surgery, dental implants, wound care, hair regrowth, facial illumination, dry eye treatment, thin endometrium. Even different faculties, they have presented their own experiences, but unless and until, who will predict the result? In only one line, when I started the treatment, I have completed 6 months to 1 year after that, only patient will decide whether it works or not. What so you are describing, what so you are presenting, even I have told people also, those who are in the beginning, true? Yeah. Now, benefits in gynecology also, hormone regeneration and premature menopause, road short, speed short, vampire disease. Now, what are the platelets? What exactly, which factor is working? Even again, I'll tell you, everyone is doing maximum people just putting in a platelet. Otherwise, also they are running in the body. Patient ask me. Otherwise, also in our body platelets are moving all over. Why they don't work and why these platelets work? And that is the only factor. Means you are pathologist. I'll tell you, I never ever go to prepare this thing by our own hands. It is very important. Everyone is specialist. Doing yourself that certification, removing that PRP. How much accuracy you are having in that? Unless and until it is given by a perfect fellow, you will not get the result. That's most important. So, tiny blood cells derived from megakaryocytes. Bone marrow, to hemocron inside, your nucleus contain dense granules, alpha granules. You can see over here. You can see this histopathological appearance. Now, what they do, what factors they have? Tissue regeneration, angiogenesis, epithelialization, proliferation and differentiation of osteoblasts and synthesis of collagen. What is growth factors? Epidermal growth factor, platelet derived growth factor, insulin-like growth factor, vascular endothelial growth factor, transforming growth factor. Then keratinocyte growth factor, fibroblast growth factor, connective tissue growth factor, alpha tumor necrosis factor and various interleukin. So you can see how these factors work. Is vascular growth and new generation of vascular endothelium. PGF working from growth of epithelial cells, endothelial cells, promotion of wound healing. This PGF factors growth and new generation of keratinocytes. PGF these factors for cell growth, angiogenesis, promotion of wound healing, fibroblast for tissue repair, cell growth, collagen production, and cell growth, new generation and repair of blood vessels and collagen production. Now, in erectile dysfunction, see even when I have discussed initially with pathologists, whatsoever is all ABCD, I read, I have gone through it. So, they have mentioned it works like anything, but unless and until we are clinical people, we cannot say the patient, it is so nice, it is having so X factor, this factor, he will tell, sir, I don't know anything, you tell me, I will get erection or not. Whatsoever is your treatment, it is good, you are a doctor, you have knowledge, so accordingly advise how to proceed. Inability to achieve and maintain erection is a major factor, leads to major psychological problems. Small penis is another major problem faced by Indian population. The big problem is that maximum people don't know what is normal penis. Exactly, even which are lower sperm, which are shower sperm, they are in such a big confusion. Even Prasanna, you have came as a sound, I don't know, such a big penis hanging down 6 inches. I am having small penis. No, this is perception. This is very, very important. Don't go and rely on patient's history at all. What is large for him, what is small for him, it is totally variant, and each and every patient is different. So you cannot apply any single criteria for the treatment, because see, if suppose the perception is different, in my experience, again I will tell you, even after putting in an implant, patient was telling me, sir, there is no implant. Now what we do? This is a big problem. Because why this happens, why this rule is useful, I tell you over here. So this was actually know it very well. I will not do it. Now, what is P short? Okay, the price per short can benefit. This is most important thing. It doesn't treat erectile dysfunction in one leg. It is a supportive therapy for your function, quality. What are the things you will achieve with this? Improved firmness of erection. Patient tell me I have erection, but sir, it's just dangling down. Is it important? No. Then enhanced blood flow and circulation in penis, greater sensation in penis, in head. Sensation in penis head is very much important, because unless and until there is a sensation in head, what sort of implant you do? Patient will come and sit on your head. So I made a new protocol. Unless and until I go through this series of P-shots, first medical line of treatment, P-shot therapy, then vacuum therapy. Because if, on day one, if you see the penis who come for the implant, it is totally collapsed, totally retracted, and even if you think of what's a small size implant, if you put it at subcutaneous level, what will happen? You can imagine, even always I am behind, to cancel the implant. I'm always behind to cancel the implant. It is at the end. Because only pinning doesn't give pleasure. And that is the reason why we have modified dissolve combinations. Then elevated sexual pleasure and stamina and increase in girth and length of penis over time. And the whatsoever thing is not just mentioned on paper. I have followed up till now at least more than 1,000 cases I did it. I have taken a feedback. Even I have seen the cases on their own. They are coming after 6 months. Sir, I am feeling very nice with this. You give me 1 piece. And that is the result. And then we will say whatsoever I am describing in this presentation is really true and is helpful for this patient. Now principles use of this is the important slide for the person who is making it. Again I believe if you are perfect, you are pathologist, you are microbiologist, you know on your own. Even many times there are preferred facts. I will not say whether how they are controlled, how much trials they did, what result they are giving. I don't know. So I don't know. Only I that much know fresh platelets which are prepared by straw freezing and straw technique. Pathologists might be doing it. So use of optimal quantity of KRP concentrate. यहाँ पे कम होगा और एक जो impure भी है वो भी निकाल लेते हैं उसके अंदर. Yield of preparation method should be maximal. Concentration of platelets in final preparation should be 7/10x. PRP product used for P-shot should be ready with growth factors and not whole platelets. If you get whole platelets, no use. Best method of ready growth factors preparation must be used. Also, they were using, I don't give this pathology factor what they are preparing. So, here the sites we are doing, we'll see when we are injecting it, what is the procedure, then how anesthesia is given, which are locations, whether definitely it should be with 6 locations. No, in all penises we cannot use 6 injections. So it is not hard and fast criteria. It depends on length of the penis, and most important, when you inject, see the diaphragm. If you are injecting it is a sac, it is going all where. So it is on choice. Now next, imperiology is a different indication. Imperiology is again when you are treating with this imperiology, don't say it will be recovered. The plaque gets softened. 50% level angulation, deviation, blood supply, healing, it may help. And if suppose you are happy and your partner is happy with the result, then only acceptable. Again, your word of caution, it requires surgery. There is the last part, excision grafting, bovine graft, or also required. So for this I will not go. Okay. These are IEF, by which how we have to score is between 1 to 25. So results, now what results I am showing you, towards 78 patients, total with the double shots we have repeated after, in few cases after 6 months, 738. So improved in score, IIF, Indian International Erectile 50%, improvement in erection, 50% improvement in intercourse quality, 50%, and improvement in sexual satisfaction. Now, here you know all the process. Still, I will show some videos how it is given. You can see over here. Is it clicking my screen? Double click. It comes black में जाके click करो. Go the folder. Exit करो उसको. Direct mode play करता है उसमें नहीं आएगा. Back करो. Exit करो procedure. Then go in folder ना. Direct video पे आ रहा है. Exit करो उसको PPT को. Back. Go in folder. PPT से बाहर निकलो. ओरिजिनल फोल्डर में अलग-अलग वीडियो रहते हैं. उसको डायरेक्ट प्ले करना है. हाँ, ओपन करो. अरे वो मेरा नहीं था. हाँ, अभी इसके फोल्डर के साथ वीडियो आते हैं जो कॉपी पेस्ट किया है उसको ओपन करो. तो इसको आता है इसका. देखो जरा ये जो पेस्ट किया है उसको ओपन करके दो मुझे. ओपन द फोल्डर. I'll just play directly from video. कट करो उसको. करो मैं बोलता हूँ आप लोग का. दोनों इसमें कहाँ पे इसका कॉपी पे. हाँ उसको डबल क्लिक करो. डबल क्लिक करो. तो फिर ये लगा. देखिए एक ही वीडियो है. आपने से पीपीटी कॉपी किया था, कभी भी बैकअप फाइल रहती है वीडियो की, उसके साथ कॉपी करना रहता है। जब आप एकदम परफेक्ट आप पता होगा बैकअप फाइल लिया तो प्ले कैसे करेगा वो? हाँ, भी अपन हो गया अभी इसको फाइल में करो, लेकिन उसी को फाइल में करो, हाँ ठीक है, उसको प्ले डबल क्लिक करो, हाँ see, you can see here such a small penis. Now someone is asking me how to make a length, how to pull it out. After getting, now I use this vibrator. Before that, before that I have applied the Prilox for at least 1 hour. I have seen different durations. 1 hour is important to get a good result. Then pull the penis and like this. What vibrator does? Vibrator at local place with high vibration, that temporary pain, it can reduce around with combination. Second thing, social video body click. Again here you can see vibration injecting. Every place, if suppose you feel you can give at 3 places, inject one. Don't go near corona. Don't go near corona of the penis because they may enter in the spongium. In cardiac, if suppose 2 places you can get divided. 1.5, 3 on one side, 1.5, 3 on other side. Okay. So after this P-shot therapy, again I advise it's a combination therapy. After P-shot therapy, we go for vacuum therapy. So why vacuum therapy is required? These cells for regeneration, for development, if you tell them that after injecting you will get a circumference will increase, you will say length will increase, automatically it doesn't increase. Even you know also what is the principle of traction given to the penis? Epithelium has to be stretched out. So after giving, you have to advise him in advance only. So only isolated PRP doesn't work. With this vacuum therapy, he is doing it for a long time, and again, same person with a small penis and putting a so costly implant of some 2 and 2.5 lakhs or something, he goes to now going to be more costly, and the penis is small and hardly 2 inches. And on day 1, or sometimes I have seen patient is referred to someone else who is doing implant. I am not concerned with anything, I will do implant. No use. The person, the doctor who is treating that person for a long time, then and then only wants to go for implant because later on what problem I have told kids, loss of sensation. You will not say I am not getting anything, I am not getting orgasm. So by using this way you can get a proper length. And after that also he is not maintained. Okay, after that also if suppose you will not get the result, then word of caution, implant is at the end. But rather than just doing, somebody has given the report, there is arterial block, this block, that block, and do implant. No. Again I have seen the cases by changing medicines, by combinations, by PRP, vacuum therapy, only cases they have reported with the blockage also. We have gone this protocol and we entered with a very nice result. So friends, only remember one thing, it's a not isolated treatment for the erectile dysfunction. It's a supporting therapy to improve the quality of erection and for the preparation of the patient for the purpose of implant, so that later on he will get this all sensation, orgasm, result, quality. Thank you very much. Yeah.
Good question. How much should be the frequency, sir? 1 a month, or what is the regimen for PRP?
Yeah. Basically, what I again, like your questions, you can say 2, 3, 4 years back, still we were facing. But now practically we reached to the point, minimum at least 3 months. Because why? Every tissue, regeneration time, we always advise them after surgery, when I should do re-surgery. Let that changes to set down. Whatsoever effect you have given, let it to grow. Give the time for the growth. The average period is 3 months. After that, according to the need of patient. Again, this is not hard and fast for everyone. In some patient, they come to me after 6 months. Okay, and for other some patients, I have seen after 1 year or so. Depending whether it is an underlying disease, diabetes, blood pressure, any collapse of the tissue, vascular problems, so many combinations, but average you can take as a 3 months.
Sir, what is about the fat adipose-derived stem cells, the fat fillers? As well as there are long penile girth enlarging hyaluronic acid fillers. What is your opinion about this?
Again, I tell you, everything is concerned with how much, see, you are written as 100% this way you. Every person will get a different result. Again, it is a topper variation of stem cell. Primitive cells. We are going to from adipose tissue, then you go for all component, adipose tissue, then from bone marrow, there is some subcutaneous fat. So whatsoever maximum you are doing, and if suppose with this minimum, this is a simple one. Because for P-shot, we are going for the bone marrow. If they are ready synthetic, hello sir? Yeah. So if it is ready synthetic, you are getting, yeah, sometimes it's a bovine. Okay, you can get a scaffold also to increase the girth. But still again I will tell you, overall perception of the patient, because see, only size doesn't matter, function. Functional output is important. Only big size, I feel that I can say it is just visually for the partner and himself, but functional is important. Hello.